Tonight, I am going to be talking again from Preparing to Die by Andrew Holacek, and I am on Chapter 10, Difficult Issues. That's where I'm starting from. So this one covers organ donations, euthanasia, suicide, miscarriage and abortions, death of a pet, and he points out that these complex issues, they can elicit highly emotional responses. He says that we need to contemplate deeply, you might say, before we act, because of the possible negative outcomes of each. And I'm going to add that books have been written, many books on each of these topics. There's a lot of opinions within Buddhism and outside of Buddhism on these topics. And this is really just an introduction to these topics. And the author says the challenge here is to offer sane advice in one brief section. And this is relatively brief compared to the rest of the book. He also gives the advice, it's best to consult with a lama that is familiar with the area that you are interested in. Then there is a quote here, remember that sometimes strong words from the Buddhist tradition about these matters usually do not come from judgmental people or those out of touch with the times. The best lamas have purest motivation to benefit others, and they also have a deep understanding of karma, the laws of karma. And he compares the laws of karma with the laws of gravity. Both affect our actions, they're impersonal, but we have to realize we can't get around them. So we have to abide by these laws of relative reality, and karma is in relative reality. Absolute reality is beyond karma. A Buddha does not create karma, does not accumulate karma, does not carry karma. And in fact, another Tibetan name translated into English for sentient beings are karma carriers. Now, here is a quote by Karmapa. This is from his book, The Future is Now. The teacher-student relationship depends on two factors. First, how genuinely a teacher guides the student towards a life purpose that matches the student's temperament and intelligence. Second, how genuinely the student follows advice is advantageous for the future. So I think that can be applied to this situation or the situations that we're going to be talking about. So the student needs to act, needs to be inspired by the Lama. You can't expect the Lama to do it for you. As always, Buddhism puts the responsibility on us for what we have done and for traveling the path and so forth. And I'm going to add that the way you ask questions is important when you're talking to a Lama and have a question. And these high Lamas tend to be clairvoyant. As a result, be able to give you better answers than I could, because I'm not clairvoyant. And I was reminded of this situation here. Quite a few years ago, decades ago, I knew a man was married. He did a month-long shamatha retreat, and his wife did not attend. And during that retreat, you might say he had an affair with a woman that was attending the retreat. And somehow or another, his wife found out about it when he came back. Of course, things got a little messy in the relationship. I really do not remember if the relationship, if they parted or not, but it was a little messy, at least for a while. And maybe a year or two later, there was a Rinpoche. I can't remember who he was, but an important Rinpoche that came to the group, and there was a group interview. Not everyone that attended the program, just members of the group that invited the Rinpoche. And I attended that. And the man that had the affair asked a very simple question of the Rinpoche. He said, "What's the point of marriage?" And the Rinpoche said, "Because it brings out the worst of you." He said nothing more than that. And of course, when the worst of you comes out, if you see it, then you've got something to work with. I have a saying, and that is, if you're going to clean house, you have to see the dirt. But that was not a random answer about the point of marriage. Obviously, the Rinpoche knew a lot more than was in the question. So the Lama's advice is important, but you have the final word. In terms of the Lama, investigate, question, examine. I remember reading an article by Khandro Rinpoche, and she was saying in the article, common sense is not so common. So use some common sense too. So he goes on to say that it's our own wisdom, our own compassion, our own motivation. This is where we take final refuge and responsibility. All of these different cases that are going to be discussed, the advice that a Lama gives you might be very, very individual based on your particular situation in one way or another. The next chapter are pith instructions by various Tibetan Lamas that have taught in the United States. And it's interesting how they too are significantly different in some ways, but are really aimed at what they think the students need to hear. So anyway, he says that reality, especially around death, is not tidy, and that goes without saying. There are just so many strong emotions about it. And he also says that you can't get around karma. That's a very important factor. Book that I had used in a previous book class was the book on karma by Tralek Rinpoche, which is very interesting. And what is not discussed in this section here about karma is karma doesn't act by itself. It isn't that there is one thing that we do and then that results in one result. We have all kinds of karma from all kinds of actions, and the karma gets mixed up and muddy, and sometimes it can be easy to say that, well, you got sick because da, 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 da. There are probably lots of different karmic factors at play. So he again says, consult with, if necessary, other lamas and contemplate fully and deeply before acting. And finally, here is I forget what they call this, but he says, these are not meant to be definitive, merely suggestive. With that introduction, the first thing is organ donation. As has been said earlier, it's best not to disturb the body for 3 days after death so that their final meditation can be honored and preserved. But on the other hand, donating organs is actually an action that a bodhisattva would do to benefit others. He says what Khenpo Sokhram Gyamtso says, he have heard from a lot of other lamas. And the quote is, organ donation is good. It is totally in harmony with the Mahayana practice of giving away parts of your body for the benefit of others, which the Buddha himself did many times as a bodhisattva. Now I'm going to add, I decided to Google, are there age limits? Because I'm 80. A lot of parts of my body are, let's just say, they are worn out. Like my heart isn't going to do anybody much good. I'm on my second pacemaker. The pacemaker, maybe. But for Vajrayana practitioners, he says that it's not good to imagine that the Yidam deity is being dissected. So when you get into Vajrayana at the higher levels, you are trying to be the Yidam throughout your daily life, even when you're sleeping, visualizing yourself as the deity. So what you do is you dissolve the visualization before giving away your organs. You no longer are the deity, you are just your ordinary body. On the other hand, he says that most practitioners are not far enough advanced to even enter this tukdam, this final meditation, those 3 days. So that's another way of looking at it. And finally, he says for advanced meditators, their practice is probably stable enough where it doesn't matter what happens to their body. So I guess I would say part of this is figuring out where you are on the spectrum of beginning to advanced. And again, talk with a lama about this, whether it's a good idea or not. So to continue here, our gross levels of our mind are connected to the physical body, and the subtle levels of mind are not. And again, this depends on how far advanced you are as a practitioner. Again, it's an act of generosity. Think about it and make a decision. And he says that as a general guideline, if a doubt about what to do, think about the benefits that others will receive, not your own benefit. He brings up the fact that there's great need. There are waiting lists for organs. So you are doing a great service. And I know a number of people that have had organ transplants. And he says that if it's necessary to harvest an organ right away, do it. That the surgeons wait, he said, 2 to 5 minutes to make sure the person is dead before beginning to take the organs out. And he recommends that before this starts, pull the hair out or tap this top of the head, Apatura Brahma, to kind of bring that person's consciousness to that point. That's where it would exit during a POA. And he says you can also put POA powder there, pills, sand from a Kala Chakra mantra. Might mix it with butter to get it to stick there. And he even says that burning incense can help. And all of these will help facilitate the transference of consciousness if it hasn't left the body yet. So that's what he has to say about organ donation. Then is euthanasia. He says this is a challenging topic. Do you pull the plug? Our motivation is extremely important. This is why we are doing it, because of our motivation. So the question is, are we doing it to remove their suffering or to remove our suffering? Who is going to benefit from this? He says, and why do we think it will bring benefit? This is really important to understand your motivations because it's such a complex issue. He said that people rarely ask for euthanasia when their needs are being met, when they feel loved and valued and have their symptoms managed, their physical symptoms managed. So euthanasia into active euthanasia and passive euthanasia. And he talks about active first here. And he says that actively ending a life, it has significant karmic repercussions. Don't do it. So he says there are two fundamental misconceptions. One is that experience ends with death. But of course, after death, then you enter the bardo. And euthanasia can increase the suffering in the bardo. The second is that the suffering that precedes death has no meaning, is another misconception, that death is actually an exhaustion of some karma. We talked about this, I think, last week in terms of pets. And it's the same way with human beings, that the final suffering, especially if the pain can be controlled and the person's emotions are able to be stabilized. We have been talking about that in previous chapters, that if that can be done, then this is actually very beneficial to purify one's karma through this experience of dying. There's a quote by the Dalai Lama: "It is considered to be better to experience the karma in this life as a human, where you have more abilities to bear it in a better way." So ending the suffering prematurely by ending life is not good. If it can be done properly, the pain is there, but it is to a certain extent controlled, and it has a new meaning, that you're actually purifying, that this is beneficial in the long run. So he says that resisting pain only exaggerates it. Embracing the pain and prevent the suffering is important. You can practice equanimity. He says, pack your bitter experience into a small mind and it gets concentrated and hurts. Make your mind as big as the sky, and that same experience is instantly diluted. So to make a big sky, in the next section, some of these pith instructions are going to say, which has also been said earlier in the book, if you can, do Tonglen. Imagine that the pain that you are experiencing is the pain of all beings, and that you are removing it from them. So then there is passive euthanasia. And this is allowing someone to die a natural death. I remember Khenpo Karthar Rinpoche talking one time about a Tibetan that was living in this country who moved back to Asia. I don't know if it was India or Nepal, because he was worried that if he died, he would be kept alive artificially, and he did not want that. Now, of course, there's all kinds of paperwork and legal powers of attorney for healthcare and so on and so forth that can be done, where you can put your wishes in writing and have someone responsible for making sure that they're carried out. But anyway, euthanasia, passive euthanasia is allowing someone to die a natural death. That if you're in a coma with no hope of recovery or kept alive by artificial means, then most teachers would say that is fine to remove whatever it is that is keeping you alive. I was down in Florida in the beginning part of May and actually was present when a person's all the machinery that was keeping him alive was disconnected and removed. And he didn't die when I was there, but I think within about 4 hours he died. And Khenpo Kartrab Rinpoche agrees with this. So there's no need to prolong life and incur emotional and financial burdens that are unnecessary. Now there's palliative medicine, and when this book, I believe it was written in 2008, and a lot has changed in those years. And because of palliative medicine, hospice care, and so forth, I'm sure he's saying at that time that fewer people were choosing euthanasia, and I think it's probably less nowadays. He says that with proper care, proper palliative care, that we can transform a difficult death into a spiritual practice. And there's a quote here by Kalu Rinpoche. The person who decides that they have had enough suffering and wish to be allowed to die is in a situation that we cannot call virtuous or non-virtuous. It is a karmically neutral act. So this can put the medical profession or medical professional that's caring for you, or the people that are caring for you, in a difficult situation, because they are supposed to they're supposed to save lives, that they're supposed to keep people alive and so forth. And of course, it's not feasible. I like to say that doctors don't save lives, they prolong life. Let's say you have a heart attack, they take you to the hospital, they do whatever they do, you recover and you live a few more years, but eventually you die. I've had a sense of humor for quite a while, and way back a long time ago, I had a cyst in my throat that I had to go and had to be lanced and drained and everything. And the doctor that did that said, "This is what killed George Washington." And I said, "Well, if you would have been there, George would be still alive." And of course not. Doctors prolong life. It can get a little dicey when you're working with medical professionals about what to do and so forth. But I think more and more they are becoming aware of this and are becoming much more flexible and more willing to go along with what the wishes are of the family or the people that are in charge of the person's medical decisions. He also talks about, since the healers have the idea of benefiting and helping the person, that even if they allow them to die a natural death, that nothing karmically negative will develop for them either. And then finally, he says that Tonglen is one of the best meditations for difficult deaths. both for the dying person to do and the caregivers to do. The next issue is suicide. And I'll begin with a quote. "The suicide of a loved one is one of the most painful events imaginable." End quote. Now, he doesn't say this. He kind of hints at this, and that is that the Tibetan view of suicide is very negative in terms of the karmic consequences. So I will say it out loud. The traditional Tibetan view is that a person that commits suicide has killed the deity, that it's a very serious karmic event, very serious karmic consequences. Now, he talks about Pure Land Buddhism, and I'm not going to go into it too much because I don't know too much about it. But he says that in the Pure Land, the Buddhist school, that it's viewed a little differently. So I'll just let you make your own decisions about what is in the book about Pure Land Buddhism. He then talks about Matthew Ricard, and that he offers a softened view that suicide results because you're intensely discouraged, you give up, you're lazy, you've ended any possibility of transformation in this life. And with suicide, you've avoided obstacles that you like to have to face in a future life. And I think plain American English, you're kicking the can down the road with a suicide, because then next life you have to deal with it. So then he goes into a discussion of karma and how it relates to suicide. And again, in my estimation, he is trying to soften this to make people a little more comfortable about when someone close to them has committed suicide, to comfort them. Let's see, here's a quote. "Understanding these four components is to comfort those left behind, not to instill a justification for suicide." So there are four parts. There is the object or the target of the action, the motivation for the action, the act itself, and then the response to the completion of the act, regret or rejoicing. So if each of those four parts are complete, then it's very heavy karma, very serious karma. And this is how he looks at suicide or euthanasia through the analysis of these four parts. So the object or the target of the action is you trying to kill yourself, or you're just trying to get rid of the pain. He says that suicide victims are terribly confused, and that the target of the act is frequently not clear. People that fail at a suicide attempt usually do not try it again. This isn't in the book, but when I was a chaplain at the prison, I received suicide training. Inmate was going to possibly commit suicide. Of course, I would take certain actions and call up psych services, and they would take over from there. I will tell you this too, that when I was 9 years old, I tried to commit suicide. And as you can see, I failed. I'm not an apparition, and I never tried it again. My own feeling was I was living in a traumatic household, and I was always getting whipped with a leather belt and yelled at and screamed at, and I couldn't seem to do anything right. And it was at 1960, and could just see the whole world going up in atomic bombs, hydrogen bombs, missiles, and da 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 da. And I'm helpless, I'm hopeless. What's the point? The world's going to end anyway. Da 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 da. So that's one form of thinking that can cause suicide. I also know a woman who has since died, whose husband commits suicide by standing at the end of the bed that she was in and putting a gun in his mouth and shooting himself in the head. And it was obviously done to hurt her. I won't go on with other stories, but this is the point, that it's done usually with a lot of confusion. So then the motivation, is it to remove suffering? Is it to kill themselves or hurt other people? And so forth. He says that a fuzzy, and I'm just putting all these words that he has in there together into one sentence, a fuzzy, bewildered, overwhelmed, triggered, etc. motivation softens the karmic impact. So he feels, again, makes it a little less serious. Then there is the act of suicide. Either you kill yourself or you don't. And he says that's where the karmic repercussions arise. And of course, since you're dead, you can't have regret or rejoicing about it. Fact is completely gone. So he says only this third component is clear and complete. The others are hazy, incomplete. And then the fourth one doesn't even exist. So he's just trying to explain why the karmic consequences aren't as serious as you might think. Then he talks about how some of these high lamas in Tibet, when the Chinese invaded, would do poa, which would eject their consciousness from their body, and their body would die before being executed. They would do that because of then the Chinese would not accumulate the karma of killing a high lama. Then he goes on to say that it is important and good to have wholesome fear of the karmic implications of our actions. And he says that this discussion is for those left behind, to soften their pain, the people that are still alive after someone kills themselves or does positive euthanasia, active euthanasia. Again, I've known families where a son has killed himself, and it left the family just, first of all, stunned, then just going through very, very difficult emotional times. So now on to miscarriage and abortion. So according to Buddhism, consciousness enters at the time of the sperm and the ovum meeting. This is for a human being. And even if it's in a petri dish, this is where life begins at conception, and that miscarriage or abortion will result in the death of a sentient being. I was in a Buddhist temple in Taiwan, and there was one room that just had the names of children that had died very young and children that had been aborted. Next to that room was a room full of children's toys. And there was a television set on, and that television set had Buddhist videos for kids. the idea was that this is where the consciousness of these kids could come. And also next to those rooms was a bigger room, and it had a few round tables, and they put out full meals on these round tables, and these were for people that had died. Now, this is Chinese Buddhism. But quite honestly, when I saw that room full of children's toys, made me cry, thinking about abortion. I've never seen this in a Tibetan Buddhist situation, but it really brought home to me negative consequences of abortion. Now, the Dalai Lama has said that if science proves all of this wrong about consciousness entering at the time of conception, then Buddhism must change. He has also said that abortion may be okay in some cases, let's say severe deformation and so forth. To go on, the author says that many teachers simply say that miscarriage is the result of karma. And then they have a quote here by Dilgo Khyentse Rinpoche. Quote, the same meritorious practice and actions can be done for them as they are usually performed for the dead. The purification practice and mantra recitation of Vajrasattva, offering of lights, purification of the ashes, and so on. So here now, abortion is more complex because it's a conscious choice. Miscarriage is not a choice. It's not a conscious choice. So again, he says to study those four aspects of karma and think long and deeply about this. And he goes on to say that when students come to these masters and say that they've had an abortion, the teachers will support them, they won't shun them, and that it's good to do practice for the dead. And then he also mentions other practices that can be done. A story just came to my mind that is not exactly in this category, but I think it's a good story. Richland has a population of 258 people. It says that on the sign when I drive in. I guess when I get there, that's 259 people. So the postmaster used to be a woman, and on the counter, she had a little porcelain Lucy in her psychiatric booth with a quarter sign on it. And she was very easy to talk to. And she mentioned to me that the reason why she had that there is that people come in and just pour their hearts out to her, almost like she was a bartender. And then one day she told me her story, which was that she got married, became pregnant, had a baby, beautiful baby. About the age of a year old, she went to the baby's crib in the morning. Baby was dead, sudden infant death syndrome. And she was devastated. She never mentioned to me anything about being religious. But what she did was that she went to the library and checked out as many books as she could on death, dying, and grieving, and so forth. And she read them and she wrote off to authors. And she only had one response from one author, who happened to be Elizabeth Kubler-Ross. And the response was, well, why did you attend one of my seminars? So she did. And Elizabeth Kubler-Ross developed this idea of the 5 stages of grieving. This really helped her process the death of her child. She became pregnant again. I don't know if it was before or after she attended the seminar, and then, the healing process started. But the next child graduated from high school, and the postmaster has retired. I haven't seen her in quite a few years now, but I can't help but feel that the fact that she was able to process her own grieving made her, you might say, receptive to other people's pain. And obviously, what was helpful was that she did something about it rather than wallowed in the grief. And I think that's a very, very, very important lesson, is do something. There's one thing about Tibetan Buddhism, is it always gives you something to do. You can never say, oh, I don't know what to do. There are always things to do. So the next is death of a pet. This is something that I have noticed about how things have changed. Nowadays, pets frequently will sleep in the room that you sleep in, and maybe even in the bed that you sleep in. People are much closer to their pets than at least my family was. And I've lived here for 54 years, and I can't have a dog now because I travel too much. But when I had a dog, it was a farm dog. It didn't come into the house, and except occasionally. He was a farm dog. He was very attached to me, and I was very attached to him. It wasn't the same as having a dog in the house right with you all the time, maybe even eating. Well, I can remember telling my mom, your dog gets away with more things than I got away with. The dog off of her plate on the table, and so on and so forth. And that's the way people are these days in a lot of cases. So they get very attached to pets, and it's understandable. They become family members. So when a pet dies, it can be very, very painful. There can be very difficult a period of time. Now, fortunately, Khenpo Karthar Rinpoche has, under his directions, there's been a Bardo packet put together, which I'm going to talk about in probably a couple of weeks. In the new Bardo packet, there is a blanket for a pet that you could bury the pet with or cremate the pet with. So the Bardo teachings apply for pets, animals, insects, just as much as they do for people. So in the Bardo, mind is mind. There's not a physical body. You have the experiences of the Bardo. Then the Karmapa said, to finish this off, Karmapa said that all sentient beings has been our mothers, and this is true, not a metaphor. That pet you can look at without you thinking of being a metaphor, as being a mother of yours in a past lifetime. Again, you can treat the death just like you would the death of a person. So you can do the same things, prayers, candles, and so on and so forth for pets. So then the conclusion of this section is, once we know the rules, I like that phrase, I'm quoting this, medical, legal, karmic, that we can work with them in an intelligent way. And that every student is responsible for checking with the guru and his instructions or her instructions. And does it make sense? The final quote I'm going to read is, gather as much information as you can, check your motivation, reflect deeply, and then trust your own heart and wisdom. And I'm going to add that it's good to have interviews with your Lama.